Hey, good morning. My name is Valentine Shena, and I will be demonstrating patient education on prenatal education on healthy pregnancy. So I will start by um, gathering my surprise, and I'll approach my patient. Knock knock. Um, Good morning, Mrs. Smith. My name is Valentine Shena, and I'm here to give you patient education on healthy pregnancy. And Are you okay with that? Okay, so I will provide privacy, perform hard hygiene, and identify my patient. May I use your wristband to confirm your name and date of birth? Yeah, that tallies with my record. So the provider mentioned that you're pregnant, and I am here to give you some do's and don'ts during your time of pregnancy to have a good and healthy time and a healthy baby. And congratulations on your pregnancy. So if you're okay, we can go ahead and do the teaching. So we'll be talking about your appointments, the testing that you're going to be doing during your pregnancy, and healthy behaviors that will get you to being successful during your pregnancy. So the appointment will start on your the appointment start from your first trimester, and you will be having a monthly appointment for the first trimester, which is in between 4 to 28 weeks. And then after the first trimester, when you come to second trimesters, which start from 28 to 36 weeks, you'll be having appointment every 2 weeks. And after the second trimester and the third trimester, which starts from 36 until birth, you'll be having more frequent weekly appointments, which will be coming in to be able to make sure that sure you're ready for birth. So during this appointment, we will, especially during the first trimester, we'll be taking your vitals, we'll be taking your body weight, we'll be doing urine testing, especially to check whether there is protein in the presence of proteins. Presence of protein indicates, in most cases, indicates infection, and especially now that you're pregnant, it may indicate pre-eclampsia. We'll also be doing fetal height and the fetal growth, and we will be using Doppler to listen to the fetal heart rate. You'll also have an opportunity to listen to your baby's heart rate. At 20 weeks, we'll also start doing fetal movement and pelvic exams. When it comes to testing, we'll do blood tests to test like rubella and any immunities. We'll also be testing for anemia. We'll be doing STD screening. We'll do hepatitis and HIV. We'll also do what? Okay, so on your first trimester, we'll do urinalysis and culture. We'll also do ultrasound. We'll also do ultrasound, which will help determine gestational age, and we'll also be doing things like chromosomal abnormalities. If need be, we will do amniocentesis. We'll also be looking for things like we'll be doing genetic testing when we do the amniocentesis. On the second trimester, we'll do glucose tests in between 24 and 28 weeks, which will determine gestational diabetes. And we will also do what? At the second trimester, we'll also do anatomy ultrasound in between 19 weeks and 22 weeks. We'll do maternal screening for neurotube defects and things like Down syndrome. On the third trimester, we will do group B, streptococcus, which is a bacteria, presence of bacteria in the vagina, and which can be passed over to the baby during delivery, and that is in between 35 and 37 weeks. We will also be checking for things like readiness to delivery, to make sure that you're ready to deliver a healthy baby. If anything comes up in between the pregnancy period that need testing, you will be contacted and the provider will let you know that you need to do certain tests. Any questions so far? Okay, if you don't have any question with testing, then we can go to nutrition. So when it comes to nutrition, during your first trimester, there's nothing much that you need to do. You can do your regular intake, healthy intake that comprises of proteins, vitamins, carbs, just your usual recommended 21 calorie meal. On the second trimester, you will do 300 more calories on top of your 21 recommended, and we will also need to do a well-balanced diet, which includes grains, proteins, vitamins, dairy, and fruits. You also need to do supplement of vitamins, and with proteins, maybe I can give you a good source of these foods. With proteins, you can get proteins from things like meat, chicken. You also need to do eggs and nuts. For fiber, you can do vegetables and fruits, and you need to do them whole. For the supplement of vitamins, you need to have vitamin A, which is a good source of a good source of vitamin A is dark leafy vegetables. You also need vitamin D, which comes from milk and eggs. Vitamin E comes from cheeses, like eating cheese. Vitamin C, which is very essential, also comes from fruits. You also need some supplemental vitamins or supplements, which include prenatal vitamins, which help with folic acid for good fetal development. You also need supplemental iron, which is good for anemia prevention. Okay, do you have any question on the nutrition? Then we can go ahead and do healthy habits. So when you're pregnant, you need to do some exercise, and you need to do moderate exercise as recommended by your physician. You can do 30-minute sessions per day, and this will include walking and light aerobic. You should avoid contact sports like boxing. Avoid sports like scuba diving, and avoid things like alcohol, drugs, engaging in irresponsible sexual behaviors or interactions. You should also be careful on things like what? I think when I remember something, I'll throw that in. So when it comes to things like weight management and weight gain, I want us to consider your BMI and BMI or the recommended BMI during pregnancy. If you have a BMI below 18, that means it is unhealthy for a pregnant mother, and you need to focus on adding 15 to 25 pounds of weight for a healthy mother and baby. For a normal BMI, you need to achieve at least 11 to 11 to no, I think that's for obese. You need to achieve at least a BMI that is reasonable for a mother and baby, which include adding healthy weight. When it comes to mothers who are obese or overweight, they should not target adding a lot of weight. They should target on adding 11 to 20 pounds during the pregnancy. And even for normal BMI, which is in between 25 and 30, you should target adding in between 10 and 15 pounds. So when it comes to complaints that are normally found during pregnancy, these include back pains and leg cramps. So with back pain, there are some sitting posture or sleeping posture that you need to adjust. When it comes to things like leg cramps, you need to flex your feet when you're sitting down and do not sit for more than 2 hours, especially when traveling. When it comes to things like nausea and vomiting, it is recommended that you eat small amount of food, regular small amounts of food, and also to use things like ginger that helps elevate them or minimize the nausea and vomiting. There are also some lollipops that are healthy for mothers experiencing nausea and vomiting. So early warning signs during pregnancy, some of these is a headache. Headache is do not just ignore your headache. When you're having a headache, it can be a sign of preeclampsia. There is also severe abdominal pain, which can signify placenta abruptio. Do not ignore leg swelling and pain. This can be a sign of DVT. And do you have any questions so far? So if you don't have any question, then I'm gonna go ahead and document that we did the teaching. We also have some information that you can take home with you. We have some preference that you can gather information from, and I'll also let your doctor that you're ready to come and see you. Thank you.